Good afternoon. Today is Thursday, April the 23rd, 2020, and this is the English language summary of the press briefing of the Center for COVID Situation Administration, or CCSA. So as you see, I'm wearing a mask now, and of course, since COVID-19 has been with us for a while, with 2.6 million infected persons around the world, we're starting to get used to wearing the mask, and I made a point yesterday that the CCSA Center is 100% wearing masks. So we encourage you to keep wearing the masks, keep up the good work on what we have done so far. And since I'm on the podium now, I would like to have to take off the mask to speak clearer to the audience. Thank you very much. So first, I'd like to start off with the issue of inclusivity in wearing masks in particular, because now there is a special kind of mask for people with hearing impairments. And this mask actually has a clear section in the middle of the mask, here in the middle, to enable the listeners to read the lips of the speaker. And this project was just launched in Thailand by the Ministry of Social Development and Human Security to overcome the obstacles of communication for the hearing impaired. Also, as we are approaching the holy month of Ramadan, may I say Ramadan Mubarak to all our Muslim brothers and sisters in Thailand and around the world. And as the spokesperson mentioned, the Shikul Islam Office of Thailand, Samnak Jula Rachamontri, has also released an advisory for Muslims on how to prevent the spread of COVID in their daily and religious activities. And this, of course, this preventing COVID will not be a hindrance to the performance of religious activities, to the performance of healthy religious activities. So moving on to the general situation and the numbers that we have for today. We have for today recorded 13 new confirmed cases, making the cumulative number of cases 2,839, as you can see on screen. Number of recoveries, discharged persons, is 2,430. Number of new fatalities, we have a similar number to yesterday and the past few days, which is 1 fatality, making the cumulative number of fatalities in Thailand now 50. The 50th fatality, the deceased, is a Thai woman aged 78 years old who suffered from strokes. And on the 24th of April, she was hospitalized with fever and pneumonia. And the test confirmed a COVID infection. And later her health began to deteriorate, and she passed away on the 21st of April, 2020. Just some observations from the numbers, from the cases, as mentioned by the spokesperson. There was an inquiry as well on social media about how many tests Thailand is actually conducting. We are conducting active case finding to be more proactive in testing COVID infection. And in Bangkok, this method has been implemented in Bang Khaen and Klong Tei districts. Also in Phuket, started to use this active case finding and found 3 cases yesterday after having used this method for the past weeks. And at the same time, we are expanding the criteria for persons under investigation or PUI so that more people can be tested. And the capacity of hospitals to test more people is being strengthened as well. Another observation is when we report to you every day about the provinces which have no new infection cases for the past 14 days, a piece of information which is different for today is that we have 9 provinces with no infection cases, but in the last 28 days now, not 14 days. So this is an improvement, 28 days with no infection in 9 provinces. And we will continue to expand this number, of course, with the capacity of each province in controlling COVID. Because just last week, no province met this criteria. Perhaps a number of provinces met this criteria in terms of the 14-day duration, but now the 28-day duration Last week, none met this. This week, we have. So this marks a very positive change. On the curfew issue, we have around similar numbers as of yesterday, which is around 600 persons violating the 600 plus persons violating the curfew in terms of leaving the residence or premises and gathering in large groups. As for some data, some detail I'll provide today is more of a range for the monthly range from the 3rd to the 23rd of April. There have been a total of 16,179 cases of people leaving their residence during curfew. And out of this number, around 2,983 were given warnings and released, while around 13,000 plus were prosecuted in legal cases. This number, in general, is reducing gradually, which demonstrates the cooperation received from the general public and the effective surveillance from the officers involved. During the same period, we also saw around 1,800 plus people violating the curfew in terms of prohibition of gatherings in large groups. Around 105 were given warnings nationwide and released, while 1,730 were prosecuted for this particular offense in detail, gathering in large groups. The number of cases has been quite stable throughout the period. Also, the government is slowly decreasing the number of checkpoints around the country during curfew, but the addition will be made in terms of security patrols around the country, because what we have found is that most of the violations may be done in residences or in certain entertainment venues. So the patrol would be more effective in searching for those who have violated the curfew or are gathering in large groups. And we hope that the outcome of this will be effective. Turning to the issue of repatriation, first of all, there were some inquiries from the foreign community here in Thailand about repatriation of their own nationals. So just to let you know that, of course, you should be contacting your embassy for this, wherein the foreign embassies in Thailand would be discussing with the Thai side on repatriation of your foreign nationals back to your country. And this has been going on for a couple of weeks, many flights already, be it nationals from the EU, from Russia, from Germany, from New Zealand. These repatriation flights of these nationals in Thailand have been going on to leave Thailand. So you should be contacting your embassy for this. For Thai nationals, repatriation of Thai nationals, today and tomorrow, we have repatriation flights to bring back Thai nationals from abroad. Returnees will be quarantined according to the standard procedure. We have some details of flights for today. One flight from Turkey bringing back 55 passengers, mostly Thai tourists and students from that country. Another flight is from Malaysia, bringing back 144 passengers, Thai nationals remaining, including Thai workers. And for tomorrow, we have a slide for tomorrow as well. One flight from India, bringing back 171 Buddhist monks and pilgrims. Another from Japan, taking home 31 remaining Thai nationals. And of course, the activities from the Thai embassies and consulates and the Trade and Economic Office abroad, we have images to show for this on this every day. So this is the Thai Trade and Economic Office in Taipei. Taipei as well, the staff there seeing off Thai nationals at the airport. This was the flight on Tuesday, the 21st, the repatriation flight. For the Thai embassy in Hanoi, we have one image here, seeing off Thai nationals at the airport on yesterday's flight, the Wednesday flight, repatriation, and the care package, varying by country. Each embassy prepares a different kind of care packages, which are essential for the nationals returning. Yes, next image, please. Yes, the Thai embassy in Tel Aviv, Israel, sending emergency supply kits for Thai students in an agricultural college in Israel, sending that off to, and then they're receiving. Okay. Next is the Thai embassy in Brunei Darussalam, Bandar Seri Begawan, distributing emergency supply kits to Thai nationals. Yes, next please. And our embassy in Riyadh, the embassy visiting and distributing supply kits to the Thai community. Yes? Yes, so these are the images that we have for today. One short piece of information I have to add is on the vaccination for influenza, because the Department of Disease Control has encouraged persons in 7 risk groups to be vaccinated for seasonal influenza. And as the spokesperson mentioned a couple of days ago, of course, not only COVID, but we have to keep keep monitoring the other seasonal diseases as well. So for seasonal influenza in Thailand, that's usually, the vaccination is usually done in this period because this seasonal influenza usually spreads during this time of year when the weather is starting to change and could make people more vulnerable in addition to the risk of being infected with COVID. And the 7 risk groups are like women, children, the elderly, and the like. One update I would just like to provide to you briefly, which I touched on a bit yesterday, is on the international cooperation that we have. So yesterday there was the ministerial foreign ministers level meeting on the ASEAN-US framework regarding COVID. So we have one image for you on screen now. So the meeting welcomed the proposals and initiatives like the ASEAN-US Health Initiative proposed by the US side, and recognized the need for information exchange for urgent research and development, as well as cooperation between the different institutions of ASEAN and the United States, such as cooperation with the US CDC, the USAID, and the other CDC institutions within ASEAN. And perhaps I can give you more detail of this in due course. As mentioned, we also monitor the questions that we have from the English language audience, the foreign community in Thailand, and those, of course, viewing this broadcast on social media and from abroad around the world as well. So one question that we had in continuation of the information released yesterday about the automatic visa extension, one question was that, does the visa extension indicate that a lockdown will be going on for 3 months? Meaning that since there is a visa extension until the end of July, will the lockdown in Thailand be going on for 3 months in terms of flight ban and other measures? The answer is no, this is not an indication. But however, because the purpose of the visa extension is to prevent the mass gatherings, to provide facilitation to the tourists and foreign nationals in Thailand, facilitating them for those residing in Thailand, so they would not have to have the hassle, meet with the hassle of coming to renew their visas during this time of risk in Thailand and around the world. And the government will be considering whether to extend these measures before the end of this month. And based on the current situation, the current details, the analysis, and overall development, which the spokesperson mentioned yesterday as well. So please kindly follow the CCSA's daily briefings for updates. So just general advice, as usual, to wash your hands, wear face masks, keep physical distance. This is what we can do now to help each other. The spokesperson also mentioned about the religious aspect of society in these days as well. And of course, in the beginning of this briefing, I also mentioned about inclusiveness. So the spokesperson mentioned about the teachings of religions and faiths. Of course, all teachings, all religions and faiths teach man and woman, mankind, to have a good heart. And also, of course, coming from a good heart, we take care of our health. Good heart and good health. So just in closing, I'd just like to say that we may be relaxing, on the way towards relaxing some measures. Thailand might be on the way in that consideration, in that assessment, towards relaxing some measures in the future. But please don't relax your guard, or else our work will be lost, our efforts, as the Prime Minister had mentioned, our efforts will come to waste. It's like we put in, we invest 100%. So we should get back 100, 150 or 200 เหมือนว่าเราได้ลงทุนป้องกันไปนะครับประมาณ100%เราก็ต้องได้คืนมา100 150หรือ200ไปเลยนะครับอย่างที่ท่านนายกได้กล่าวนะครับก็อยากให้ทุกคนสู้ต่อไปเพื่อให้มีการป้องกันนะฮะจากโควิดเนี่ย 100% เลยจนกว่าโควิดจะสิ้นซากไปจากประเทศไทยThank you for your attention. สวัสดีครับ